Hold your hand up right now. Look at your nails. Not the polish, not the shape, the surface, the colour, the base, the edges. Most people have never looked at their nails the way I am about to show you. Most people trim them, file them, occasionally paint them, and otherwise ignore them completely. And that is a mistake that has cost people their lives. I have been practicing internal medicine for 15 years. In that time, I have seen nails that told me a patient had lung cancer before their chest X-ray did. I have seen nails that showed me liver failure before the blood tests caught up. I have seen nails that revealed autoimmune disease, heart failure, and severe anemia months before the patient felt a single symptom they would have described as serious. Your nails are a 6-month biological archive of everything happening inside your body. And right now, at the end of your fingers, that archive is open. The question is whether you know how to read it. Most people do not. Most doctors do not check nails thoroughly in a standard 7-minute appointment. The signals your nails send are not subtle. They are specific, documented, and in some cases, they are the earliest warning your body is capable of producing before disease becomes advanced. I'm Dr. Arthur Sterling. Subscribe right now and hit like. What I'm about to show you, look at your nails as we go through this together. To understand what your nails are telling you, you need to understand what they actually are, because most people think of them as dead tissue, like hair. They are not. The nail plate, the hard surface you can see, is produced inside the nail matrix, a small zone of living tissue tucked just under the skin at the base of your finger, beneath the cuticle. The matrix is extraordinarily sensitive. Every disruption in your body's metabolism, every nutritional deficiency, every inflammatory process, every hormonal shift, the matrix records it in the nail plate it produces. The plate grows approximately 3 to 4 millimeters per month. A full nail replacement takes 4 to 6 months. Right now, on your hands, you are carrying a 6-month archive of your body's internal history. Every ridge, every color change, every spot, every deformity is an entry in that archive, recorded at the moment it happened and preserved until the nail grows out. The nail bed, the tissue beneath the plate, is threaded with capillaries. Blood shows through the plate, giving a healthy nail its pinkish tone. The composition of that blood, the oxygen level, the hemoglobin concentration, the bilirubin level, is visible through the nail right now. When hemoglobin drops, the nail pale. When oxygen falls, blue-gray appears. When bilirubin rises, the breakdown product of red blood cells that the liver must clear, yellow spreads across the plate. Each color shift is a direct window into what is happening in your bloodstream at this moment. No blood draw required, no appointment needed, just light and knowledge. Let me start with the signs that require the most urgent attention, the nail findings that have been documented as early indicators of malignancy. I want to be precise about this. A nail finding does not diagnose cancer, but specific nail findings have been documented in the medical literature as appearing months before cancer was detected by conventional testing. In a number of published case reports, patients presented with nail changes were investigated because of those changes and were found to have early-stage malignancies that would not otherwise have been found for months. Sign 1. Clubbing. Look at your fingertip from the side. A healthy nail has a gentle outward curve, a shallow arch. Clubbing is when the nail becomes excessively convex, domed, rounded like a watch glass, and the fingertip itself thickens and becomes club-shaped. Clubbing is present in approximately 35% of lung cancer cases and appears months before respiratory symptoms develop. It is one of the earliest paraneoplastic signs in pulmonary malignancy. The mechanism involves substances released by tumors that stimulate soft tissue growth around the distal finger joints. The fingertip expands, the nail arches. There is a simple test you can perform right now. Press the nails of matching fingers together, nail to nail, same finger, both hands. In a normal nail, a small diamond-shaped gap appears between the bases of the two nails. If no gap exists, if the nails press flush, that is called Shamroth's sign, and it warrants medical evaluation. This test takes 3 seconds. It has been used in clinical medicine for decades. Most people have never heard of it. Sign 2. A dark, longitudinal streak. Look at each nail carefully. Is there a narrow brown or black line running from the base of the nail to the tip on any single finger? A dark, longitudinal streak under the nail can be subungual melanoma, a form of malignant melanoma that develops beneath the nail plate and is particularly dangerous because it is frequently mistaken for a bruise or a fungal infection for months or years. The warning features that require a dermatologist appointment this week, not next month, are a streak wider than 3 millimeters, blurred or irregular edges, uneven color within the streak, and pigment that has spread onto the skin of the finger beyond the nail edge. This spreading of pigment onto the surrounding skin is called the Hutchinson sign, and it is one of the most specific indicators of subungual melanoma in clinical examination. Bob Marley died of subungual melanoma that was initially dismissed as a soccer injury. Early detection of subungual melanoma at stage 1 has a 5-year survival rate above 80%. Stage 4 survival drops below 20%. The difference is detection, and detection begins with looking. Sign 3. Leukonychia, white nails. If the entire nail plate has turned uniformly white, milky, opaque, with no pink showing through, that finding is associated with serious liver dysfunction. Terry's nails, where the nail appears completely white with only a narrow pink band at the tip, are a classic early sign of liver cirrhosis, appearing before jaundice develops and before most standard liver enzyme panels become dramatically abnormal. If you see this on multiple nails simultaneously, not one nail from trauma, but several nails with the same white appearance, liver function should be evaluated as a priority. Sign 4. Yellow nail syndrome. All 20 nails, fingers and toes, turning yellow simultaneously, thickening dramatically, and growing extremely slowly while the cuticle nearly disappears. Yellow nail syndrome is associated with lymphatic drainage failure, chronic respiratory conditions, and has been documented in association with several malignancies, including lung cancer, lymphoma, and breast cancer. The nails reflecting the systemic lymphatic dysfunction that the tumor is producing. Beyond malignancy, the nails display specific, documented signs of systemic disease that most people are walking around with. Unread, unrecognized, unexplained. Spoon nails, koilonychia, where the nail develops a concavity, a dip in the center like a tiny spoon rather than a gentle arch. Spoon nails appear before iron deficiency shows up on a standard blood test. The peripheral tissues starve for iron before hemoglobin levels drop, and the nail matrix is among the first tissues to show that starvation. If your nails are concave, if a drop of water placed on the nail surface would sit in a pool rather than roll off, iron studies should be your next blood draw. Beau's lines, deep horizontal grooves running across the nail from one edge to the other. These are not the gentle ridges of aging. These are distinct furrows, channels you can feel with your fingertip. Each Beau's line marks a moment when the nail matrix temporarily stopped producing. A severe illness, major surgery, chemotherapy, or profound physiological stress. The distance from the groove to the cuticle tells you exactly when it happened. Divide by 3 to 4 millimeters per month growth rate. Multiple parallel Beau's lines mean multiple episodes of systemic crisis. Pitting. Tiny pinpoint depressions on the nail surface, as if someone pressed a pin into it repeatedly. Nail pitting is one of the earliest signs of psoriasis. It can appear years before the characteristic skin plaques develop anywhere on the body.
meaning your nails are warning you about an inflammatory process that has not yet surfaced elsewhere. The same pitting pattern occurs in alopecia areata, the autoimmune condition that attacks hair follicles, often striking the nail matrix simultaneously.
The nails are particularly revealing about cardiovascular and circulatory status because the capillaries of the nail bed are some of the most accessible small vessels in the body. Splinter hemorrhages, thin, dark red or brown lines running vertically under the nail, resembling splinters trapped beneath the plate. In someone with no history of trauma, multiple splinter hemorrhages across several nails simultaneously have a specific clinical significance. Multiple atraumatic splinter hemorrhages are a classic physical finding of infective endocarditis, bacterial infection of the heart valves, appearing on the nails as microemboli from infected valve material lodge in the nail bed capillaries. Blue or grey nail beds, when the pink of the nail bed shifts toward blue or grey without trauma or cold exposure. Blue nail beds indicate tissue oxygen starvation. They appear in chronic obstructive pulmonary disease, severe asthma, congenital heart defects, and severe anemia. The nail bed is showing you what the blood inside the capillaries contains, or in this case, what it lacks. Let me tell you about a patient I will call Margaret, 64 years old, retired librarian. She came to see me not because of her nails. She came because of a persistent cough that had been present for 6 weeks and was not responding to anything her previous physician had tried. She sat across from me, and I asked her to put her hands on the desk. She looked slightly confused. She had come about a cough, not her hands. But I had noticed something when she sat down. Her fingertips were enlarged. Her nails were domed. The curve was unmistakable, not dramatic, not grotesque, but clinically present. I pressed her nails together. No diamond gap appeared. Shamroth's sign was positive on both hands. Bilateral clubbing that had developed gradually enough that Margaret had not noticed it herself. I asked her when she had last had a chest X-ray. She said never. She had always been healthy. I ordered one that afternoon. The radiologist called me before the end of the day. There was a mass in the right upper lobe. Margaret's nails had been showing the cancer for months before her cough became significant enough to bring her to a doctor. The clubbing had preceded the respiratory symptom. Her fingers had known before her lungs announced it. The mass was resected 6 weeks later, stage 1B. Her oncologist told her that the early detection, driven entirely by the nail examination, had likely made the difference between a curative resection and a palliative situation. Margaret sends me a card every year. Her nails, she writes, saved her life. They did not save her life alone, but they started the conversation that saved her life. That is what nails do when you know how to read them. Here is the examination protocol I want you to follow once a month. 5 minutes, good natural light, no nail polish. Step 1. Remove all polish completely at least once a month. An opaque coating hides everything beneath it. Step 2. Examine color, pink and even normal, yellow, fungal infection or systemic process. Blue-gray, oxygen issue, evaluate. Pale across the board, possible anemia. Dark longitudinal streak on any nail, dermatologist this week. Step 3. Shamroth's test. Press matching fingers together. Diamond gap, normal. No gap, medical evaluation. Step 3 takes 3 seconds and has detected lung pathology before chest imaging in published case reports. 3 seconds, both hands. Do it now. Step 4. Surface and shape. Run your fingertip across each nail. Smooth, normal. Deep horizontal grooves. Body recorded a crisis. Note when. Pitting. Autoimmune evaluation. Spoon shape. Iron studies. Step 5. The nail fold.
The skin at the base of the nail, the cuticle area, contains capillaries visible under magnification. Enlarged, distorted, or absent capillaries in the nail fold are an early sign of systemic autoimmune disease, including scleroderma and lupus, before joint symptoms or skin changes appear elsewhere. Everything I described today becomes more clinically significant after 60. After 60, the nail matrix produces thinner, slower-growing plates, making changes more visible. After 60, the diseases these signs reflect, malignancy, cardiovascular disease, autoimmune conditions, are more prevalent. After 60, the window between early detection and advanced disease narrows. How old are you? Write it in the comments right now. I want to know who is watching, because the nail examination conversation at 55 is different from the conversation at 72. And what I cover next will be shaped by exactly where you are. Here is your action plan. Remove nail polish from at least 2 nails right now. Examine them in natural light. Do Shamroth's test. 3 seconds, both hands. Look for any dark longitudinal streak on any nail.
If you find clubbing, a dark streak with irregular edges, uniformly white nails across multiple fingers, or multiple splinter hemorrhages without trauma, do not wait for your next annual physical. Request an appointment this week. Your nails have been carrying this information your entire life. 10 minutes once a month is all it takes to read it. I'm Dr. Arthur Sterling. I have spent 15 years watching patients arrive after diagnoses that their nails had been trying to announce for months. Subscribe, hit like, and send this to someone you care about, because the most important thing about early detection is that it requires someone to look. The healthcare system waits for symptoms. Your nails do not wait. They speak first.